Good afternoon, everyone. Welcome to our training. Lindsay had reached out to us from Coordinated Care, wanting to just share some of the details about Medicaid and stuff like that for our youth, and then also a new program piece that's launching that they wanted you all to be aware of too. I don't know that much about it, so I'm going to let Lindsay explain way better than what I just did. But with that, I am going to turn things over to Lindsay. Lindsay, go ahead.
Thank you, Ryan. Thanks for hosting today. Good afternoon, everyone. My name is Lindsay Green, and I am a community educator with Coordinated Care's Apple Health Core Connections program. So I think many of you are probably familiar, but Coordinated Care is the Apple Health or Medicaid plan for children and youth who are in foster care, adoption support, alumni of foster care through age 26, as well as for families who are reunified with their parents. They can remain with our specialized program for 1 year post reunification. I will give you my slides after today's training too, so don't feel like you have to write everything down. We'll make sure we get you those resources out. For some of you, some of this information may look a little bit familiar and might be a little bit of a refresher, but we wanted to come back because it's been a little while since we've presented to CASAs, and we wanted to share some updates related to COVID and just kind of changes that have happened with the program. And we really wanted to share today about the exciting launch of our foster care centers of excellence. So statewide here in Washington, we now have 3 foster care centers of excellence. And they are actually going to join me today to share a little bit about their programs. So we have Ren Whitman here today, and she's going to talk about Harborview's Center of Excellence. And then April, I saw her for just a minute, and then she must have gotten kicked out. So hopefully she'll be back on. She is with Community Healthcare down in Tacoma. And then we have someone joining from Excelsior Family Medicine out in Spokane as well. So they'll share a little bit more about their programs and what they're able to offer. But I thought first, just doing a quick refresher on Coordinated Care and some helpful information that you may not be aware of, because it's been a few years since we've done this for CASAs. So thank you so much for having me. And I'm going to go ahead and share my PowerPoint. Feel free to hop on and ask any questions you have. I have no problem with anybody interrupting and jumping in with a question. That is totally fine. And you can also use the chat box if you'd like to put a question in the chat. So Apple Health Core Connections is a program within Coordinated Care. And it's the program that serves children and youth who are in foster care. And we also like to start all of our meetings and trainings with a land acknowledgement. So because we are statewide today, recognize that we're gathered across the ancestral tribal lands of Washington, and we honor the strength and resilience of tribal people and express gratitude for the many gifts and learnings that they bring to our communities. So I'm on the land of the Coast Salish peoples today. And if you're not familiar with whose land you're joining from today, I encourage you to visit the native land map to learn a little bit more and to connect with the tribal lands that you're on. Okay, so we want to talk real quick today about who's served, kind of the basics of the program, what happens when a youth enters care in accessing physical and behavioral health services, rural, small on care coordination, some questions and answers, and then I'll really just be turning it over to the foster care centers of excellence to share the awesome work that they're doing. So again, just if you're not familiar with this program, we have about 25,000 members statewide. Over half of them are really in adoption support, but children and youth in out-of-home placement, and then youth when they turn 18. If they are in care on their 18th birthday, they remain categorically eligible for Medicaid through the month of their 26th birthday. So if they're in extended foster care, they stay with us. If they're not in extended foster care, they still stay with us until they're 26. And then children and youth who are reunited with their parents can stay with us 1 year post-dependency, assuming that the parents are eligible for Medicaid. A few exceptions to enrollment. This gets kind of complicated. If you're working on a case and a family is having a hard time accessing physical and behavioral health services and you can't seem to figure out whether or not they're a coordinated care member or not, you can always just reach out to me or to our team and we can help you navigate those kind of complex enrollment situations. So the biggest one is Native youth are not automatically enrolled in managed care here in Washington. And so a Native youth may or may not be enrolled in our program. And if they're not, so then they have coverage through what's called fee-for-service or ProviderOne. So that's the biggest one. And then youth who are involved with juvenile justice, if they go into a juvenile rehabilitation program, they are not covered by coordinated care while they are in detention or in that JR facility. But there should never be a lapse in coverage. So immediately upon release, they should be covered, and there should never be any kind of gaps in coverage for medical services. So here's the House bill that allowed for youth to stay with our program 1 year post reunification. There's no online application option, so they either need to call the healthcare authority and apply over the phone. It should take no more than 10 minutes, or they can also, if they want, they can send in an application and we can help with that. So if they need help filling out the paper application and kind of scanning it in, we can help with emailing it over to healthcare authority. Okay, so I'm gonna skip through some of this here. The basics of why, right? Why do we have managed care for youth in care? Really, the key piece here is we want to help navigate the physical and behavioral health services to really take that off of a caseworker's plate and off of a caregiver's plate. And we really believe that when kids are accessing the care they need at the time that they need it, it's going to improve their well-being across, lots of different domains, right? So hopefully it'll help with stability in school, in their placement, and just increase wellness among members and their families and caregivers. Real briefly, if you are used to our program back in 2016, you might say, I would never use your Find a Provider tool online. We'll give it another shot. It's been a while, and we've definitely made a lot of improvements to it. It's still not going to be perfect. I think one of the hardest things is it's near impossible to have it updated on a daily basis as to who's accepting new patients and who's not. So if you're ever working with a family and they say, we need this kind of specialist, and I went to the coordinated care website and I called the first 3 specialists that were listed and all of them said they're not accepting new patients right now, that's when you say, whoa, did you just call coordinated care? Because that's when we want to be able to help take that off of a family's plate, right? We don't want families to have to deal with that kind of frustration. So if you're having issues with finding a provider on our website, emailing us or calling us is a really great next step. So here's what the ID card looks like. One key piece to know is that we don't automatically mail out a new ID card every time a placement changes. So our hope is that the card will go with the child if they switch placements, but we know that's not always the case. So if you hear from a caregiver that they need an ID card, you can reach out and we can help with that. You should also know that no provider or pharmacy should ever turn a family away for not having the physical ID card. But we do hear sometimes of situations where people really do want that physical ID card. So let us know and we can help get a new one. If you're just kind of curious in general, what does Medicaid cover here in Washington? I'm not going to read you this whole list. You'll have it to kind of take away. But here's sort of the big picture, what's covered. The basics here are, if it's deemed medically necessary, right, it's going to be a covered benefit. So doctor office visits, urgent care, the ED, your physical therapy, speech therapy, occupational therapy, those kinds of things. Behavioral health services, so both mental health and substance use disorder treatments are covered. Durable medical equipment, that includes pull-ups for children that have a diagnosis of enuresis or encopresis. If you ever need help getting durable medical equipment for a family, they can reach out to us and we can help get that set up. Vision exams, dental exams are also covered by Medicaid. You don't see that listed on here, and it's a little complicated, but it's covered. And hearing exams, hearing aids, all that good stuff are covered. I'm not going to share this with you. I think you probably know this, right? We always encourage to go to the right level of care. So just know that urgent care is out there for families and it is definitely covered. So that can be a great resource for families if they don't need the ED. Pharmacy benefits. Prescriptions are covered. Some require prior authorizations, or there's kind of some nuance for certain medications. So just making sure families are working with their provider. And if you're running into issues, you can reach out. There's a link in here to the preferred drug list because many over-the-counter medications are actually covered with a prescription. So here are a few examples. And a family, if they're using over-the-counter medications, they can ask a provider to write a prescription. and then get that filled at the pharmacy. So you can see some examples up here. Just a really great benefit that families don't always know about. And for those of you working with relative caregivers that are maybe under some financial constraints, this might be a really great resource for them. Pharmacy benefits specific to COVID. In response to COVID-19, we've made some changes in how our pharmacy program works, including we've added a lot more medications to the 90-day maintenance list, which means that those medications can be delivered to a caregiver's home through mail order through pharmacy home scripts. And so that can just reduce the number of trips out into the community that they have to make, and just add some ease and convenience there. So this is like a really detailed list. If you ever had a family and they were like, could I get this delivered to my home? If you're looking at the long kind of preferred drug list there, you're looking for that MP, which marks it as part of the maintenance medication program. And we can help with that. I don't want you to have to memorize all that, but you can reach out if you think that might be a benefit for a family. Vision, if a youth is under 20, they can get one eye exam per year. And hardware or glasses are also covered through Apple Health here in Washington. So we really encourage youth who are getting close to that 20 age to go in for an eye exam and get another pair of glasses. Apple Health also covers replacement glasses. So if you're working with a young child who maybe because of some trauma has some challenging behaviors that's led to glasses breaking, there are replacements available as well. I get questions about contact lenses a lot, so I'm just going to go ahead and say it. Contact lenses are covered if they are medically necessary. So sometimes youth want them for more cosmetic reasons. And so they're not covered in that situation, but they are covered for certain conditions where contacts are required for treatment. A youth over the age of 21 is eligible for an eye exam every other year and no longer eligible for glasses or hardware. So after today's training, I can send you a list that organizes it by county with places that will offer discounts for adults who are on Medicaid to receive some glasses at a lower cost. Honestly, I hear from a lot of folks that they prefer, Zenni or America's Best or Costco or other places where, glasses are fairly affordable, but it is an option to know about. Okay. I'm not going to go a ton into this. Some youth just have their behavioral health services covered through coordinated care. That's going to be kind of a complicated situation. That's when you're going to want to say, let's reach out to coordinated care. I kind of forget a little bit about that. But just know that for some families, they might have what's called behavioral health services only, or BHSO, through coordinated care. Behavioral health benefits. So that includes WISE, or wraparound with intensive services. That's probably one of the ones you'll hear about the most often, or be using the most often for your kids. It's available, statewide. It averages about 10 and a half hours of services per month. And it's a wraparound model. So there's peer support, family support, as well as, professional behavioral health therapists who offer support to the family as well. So WISE is covered by Apple Health here in Washington and is available for youth who are in foster care. As of January 1st, 2020, WISE is also available to youth who are in BRS, or Behavioral Rehabilitation Services. So that's kind of a new thing that sometimes folks are not aware of, but youth can be receiving BRS services and WISE services at the same time. The crisis lines are still a resource that are available. If you're not familiar with the crisis line in your region, feel free to click on the link in the PowerPoint. Like I said, I'll be sending out these slides afterward. It's a great resource to know, right? The crisis lines can help, with de-escalating a behavioral health crisis. They also have the designated crisis responders there as well. I always say though, if a youth has behavioral health services through a provider and they offer crisis, you really might want to start there because they know the youth, right? So they might be, the most responsive and really the ones that know how to help de-escalate that child the most. So every youth should also have a ProviderOne card. This number is also located on the coordinated care ID card. And again, families should not have to, have the physical card to get services. So here in Washington, there are a few things that still go through ProviderOne instead of the managed care plan. So here are those ProviderOne benefits. It includes dental, as well as eyeglasses and early support for infants and toddlers, certain transgender benefits, as well as transportation for medical appointments. So again, no family should ever have to know, is it going through coordinated care? Is it going through ProviderOne? But just sometimes people are like, why are there two cards? It's because some things are still, kind of going through that ProviderOne system as opposed to managed care. Families can reach out to us for help accessing these services. So if you're hearing of a family who's having a hard time accessing dental, we can still help navigate the system, even though it's covered through ProviderOne. So if you haven't heard of the non-emergency transportation program, there's a different regional broker in each county that can provide assistance with transportation to medically necessary appointments, as well as to pharmacies to pick up prescriptions. And so they're going to use the most cost-effective means available. So that could look like bus tickets, potentially gas money or rides. So it could look a lot of different ways. And this can be a great resource for families as well as for youth you might be working with that are starting to, gain a lot of those independent living skills as well. So if you'd like more information, you can see who the broker is in your county. I'm going to go through pretty quick here. When youth enter foster care, at the time of placement, the caregiver should be given an interim voucher. And that interim voucher is just a one-pager. It looks like this. And caregivers should fill it out to the best of their ability. They may not know all the information. And so hopefully they can work with the caseworker to get most of it filled out. And they can take it, at the time when they're going to a provider to receive services or to the pharmacy to pick up medication. And basically it's just a letter that says, hey, provider, this child is, just entering foster care. They don't have an ID number yet through coordinated care. We're still getting all the system stuff worked out. Please see this child. Don't delay any kind of care. They need to be seen, and coordinated care promises to pay, right? We just need to wait for that ID number to get in place. So if anybody runs into any issues with it, we really encourage all caregivers to have our phone number saved in their cell phones so that they can call us after hours or, when they're at the pharmacy at 8 p.m. and running into an issue with that interim voucher. Hopefully that won't happen, but just in case, we really do want to make sure people have that phone number handy and available when they need it. All caregivers should receive a welcome call. So when a youth enters care and we get that information and that data over, we're going to reach out because we want to make sure we've got, kind of everything in place for that youth so we can help identify any referral services that they might need if a EPSDT has been done and if they need help, locating some of those services that have been recommended. We can answer questions about the program and benefits available. And then also this first bullet up here, confirm a member's primary care provider or PCP. So we're required to auto-assign a primary care provider to every single person in our program. And we don't know who, that child is going to go to, right? We don't know who that caregiver often takes their placements to. And so it just gets auto-assigned, but it's very, very easy to call us or during that welcome call, say, this is who the PCP is. Can we change that? And it's a super easy process to just get that updated in the system. You could call us at any time to do that. So if you get to a provider's office and the caregiver hears, oh, we can't see the child today because we're not listed as the PCP on record, you should just whip out your phone and call us right then and there from the waiting room, and we can help with that. And providers should know that they can see any of our youth, even if they're not listed as that PCP. So that's just a little bit. Our care coordination is really the heart of the model. When I keep on saying call us, what I'm really saying is call our care coordination team. They are wonderful. You can also reach them by email. And anybody can make a referral to our care coordination team on behalf of a family. So all of you wonderful CASAs, when you are out with a family and you're hearing, hey, we can't find a dentist, or we're having a hard time finding a therapist that's a good fit, or there's a surgery coming up and there's all these providers that are involved and nothing is making sense. That's when you might say, hey, have you reached out to coordinated care? And if they say, no, I don't even know how to do that, you could email on that caregiver's behalf. And just kind of let us know the child's name, date of birth. If you have that ProviderOne number or that coordinated care ID number, that's great. and then just kind of letting us know what the issue is. And that'll help us figure out how quickly to respond and reach out. So in general, it's about 5 days or so, and we'll reach out and we do a health screening. So sometimes that's frustrating for caregivers. And if you just want to let them know, hey, when coordinated care reaches out after that referral is made, the very first step is doing this 10 to 15-minute health screening. And we do that to make sure that, okay, you're calling and asking for help about dental, but are there all these other things that you might need help with too? So we want to just make sure we're filling in all of those care gaps at one time, and kind of doing that general screening to make sure we're not missing anything. Some examples here of times when our care coordinators have, these are real life examples from the last few years, but times our care coordinators have really assisted families. A wait list of over 6 months. Not to say that we can magically make wait lists disappear, but there have been times where there have been some kind of special circumstances and we've been able to help find a provider that can see the youth sooner, or work to get that child seen quicker. The second one on there, that was a real situation as well, and we were able to locate a naturopath that was much closer to the family. They were looking at having to drive a couple hours to access that service. So just kind of some examples. More examples. I'm not going to read you through all these. Again, the key piece here, we want to make sure every caregiver has this phone number saved in their phone, and also knows about this email address. Email is just so great. So one of the other things, that we still are dealing with is getting data directly from DCYF and from FamLink. We don't have that yet. And so we have to verify that the caregiver is in fact the placement of record, right? We have to verify who we're talking to, because we need to protect children's health information, which I think everybody can agree with and be on board with. But it can be a frustration to have to put a caregiver on hold while we verify that placement behind the scenes. So emailing can be a really great way to let us know that you have a need, and we can talk with the DCYF and make sure that it's the caregiver of record, and then kind of go from there. It can be a one-time request, ongoing until issues are resolved and reopened at any time. So there's no maximum. If you call 1 month for some help, there's nothing that says you can't call back the next month. You can call back as many times as needed. And a few other kind of cool things to know. At Coordinated Care, we offer a no-cost membership to the Boys and Girls Club for all of our youth. So that includes all the youth in our Apple Health Core Connections program. So it doesn't cover all of the special camps and programs that are run through Boys and Girls Club, just the membership, but still a really, really great opportunity. And Boys and Girls Club have just been an amazing partner with Coordinated Care. We've done a lot of training with clubs across the state to provide them with more education around trauma-informed care practices so that they're best able to meet these needs. And it's just been really exciting to work with them. The 24/7 nurse advice line, many pediatric offices offer a 24/7 nurse line as well, but it's another one in case that's a needed service. The rewards program is also new. That used to not be available to children and youth in out-of-home placement. That's now available to everybody within Coordinated Care, including youth who are in foster care. So they get, caregivers should receive a Visa card in the mail. It's a lime green Visa card and it says My Rewards on it. And after they take the child in for that well visit, money gets loaded onto that Visa card that they can use, almost anywhere, right? For so many different things. No alcohol, tobacco, firearms, or ammunition. For a health plan, I feel like that's pretty reasonable. And for adolescent well visits, so I think it's for youth ages 12 to 20, if you can get them to go to the doctor for a well visit, they actually get $40 in rewards. So for some ages, it's $10 for going for that well visit, but for some ages, it's actually more. So a great benefit to encourage youth to go in for those preventative care appointments. The Healthy Kids Club, Cece the Panda is our mascot. She's getting back out into her social scene as things open back up and Cece's vaccinated. And so if you ever have any community events in your county where it would be helpful to have a giant panda, please feel free to reach out to me and we'll see if she can squeeze it into her social calendar. And Start Smart for your baby. If you're working with any youth who are pregnant, they can apply for the Start Smart for Baby program. They're able to get a convertible car seat that goes from 5 pounds to 40 pounds. It's not the infant bucket seat that I know a lot of people like that kind of clips into strollers and bases, but it is a convertible car seat that goes from 5 pounds to 40, rear facing to forward facing. And they also can get a double electric breast pump. So Apple Health or Medicaid says we have to offer at least a hand pump, and as a mom of 2, I am very thankful that we say that's not nearly enough, and we offer that double electric. So just a couple of extra added programs. Teladoc went live in February. That was just kind of coincidence, but it happened to be really good timing for COVID. So Teladoc is Coordinated Care's telehealth provider. Families can access telehealth services through their pediatric office or any kind of provider that they may be seeing. But in addition to that, they also have access to the entire Teladoc network. So Teladoc has a network of providers that are all Washington-based, and it's available 24/7 for non-emergency issues, so that they can connect without having to travel into an office. So they can access that via the mobile app or phone or web. It's super simple for a caregiver to sign up an account for a youth. I was actually on the phone with one of our alumni members who's like 19 or 20. And I was telling him about Teladoc, and he said, "Oh, I bet it's going to take forever to sign up." And I said, No, really, it'll take you 2 minutes. And he said, "I don't believe you." And I said, "Let's do it right now." And he said, "Okay, fine." And so he literally signed up for Teladoc while I was on the phone with him. And I can attest that it was a very smooth and easy process and really didn't take long at all. So encouraging families to sign up for Teladoc now so that they have it when they need it. Can use it for all kinds of things, including dermatology. So that's a specialty that's included in Teladoc. You might have to take a picture or kind of video with the dermatologist so they can see the skin condition, but just a great resource. And then behavioral health services are available through Teladoc, but only for our members who are over the age of 18. So if you work with any alumni members, that's a benefit that's available to them as well. We have liaisons that work closely with DCYF. They're still here if you're familiar with that program. I'm part of the community education team. I recognize a lot of names on the call today. So I see some of you join our monthly webinars, which is so wonderful to have you all there. The SafeLink cell phone program is available for just our alumni members and our adoption support members. So SafeLink is a federal cell phone program. It comes with a smartphone, or you can get just the SIM card if the youth wants to just take the SIM card and put it into their own phone. It comes with unlimited texting, which is great, and a data plan. And I think it's 350 minutes. They upped that to 500 during the pandemic, but I think it's usually 350 minutes per month. And then alumni and adoption support members can also access an online member account. They set up the account, they can see, all that claims and benefit data, as well as, get a printout of a temporary ID card, all that kind of stuff. That's not currently available for youth who are in foster care, out of home dependency, just because of concerns around health privacy, right? How do we ensure that the right people have access to that member account? If you have any problems with the coordinated care program, we really want to be accountable and transparent. So here's all the email addresses of some higher ups that oversee the program, both at HCA and DCYF and internally as well. Medicaid events, you can check our website. We also try to email them out once a month for what's coming up the next month. But all those trainings and webinars are posted on our website. Again, please save that 844 number in your phone, or tell caregivers too. We really like to make sure they've got it handy. And emailing us, again, is super convenient and easy. And now I love to give, how did I do on time? I did perfect. I'm exactly where I wanted to be. I wanted to save lots of time for our Centers of Excellence to share today. So our foster care Centers of Excellence are a new program that just launched. What is a foster care center of excellence? It's a one-stop shop to access, all the services that youth in care need, and they'll tell you more about that. But really the idea is that we wanted specialized programs that could really truly meet the unique needs of children and youth in foster care. So we have 3 COEs across the state. Harborview Pediatrics Clinic launched in October, and then Excelsior out in Spokane in December, and then Community Healthcare in Tacoma. We just had a big party celebration yesterday for CHC. So I am going to let them talk a little bit more about the program and what they're able to offer. But this is a really great resource for caregivers that you might work with that are near one of these 3 centers, or for a child or youth who may be changing placements that will be near one of these 3 centers. And I see Sherry on camera, so I'm gonna see if Sherry maybe wants to go first to talk about Excelsior.
All right, well, I appreciate the introduction, Lindsay. Thank you so much for the invite to be here with all of you. Excelsior is located in Spokane, like Lindsay said. We were designated as a center of excellence in December of last year. And so we engage both foster parents and social workers in arranging appointments for the foster child. We keep availability in place for same day or next day appointments on 3 provider schedules. We do not have a wait list for any foster care child need, no matter where they are in process. And we're very flexible. If there's something urgent that would come up, we are more than happy to squeeze someone in. Excelsior is unique in that we also have an internal BRS Plus unit through our integrated care center. And all of the children in BRS are automatically registered with the clinic and have access to primary care providers. So we can do an EPSDT upon their arrival into the ICC, or as they're preparing to leave to go to their next destination. We can do another exam. So we send them on their way with everything up to date. We also have staff that are designated as care coordinators. These are point people within our family medicine department who will complete medical research on the child, look at their vaccination records, either through the state or schools. They assist foster parents with DME orders. They review over-the-counter purchasing that's provided through coordinated care. They'll manage referrals to specialists such as occupational therapy, vision and dental appointments. If Excelsior Family Medicine isn't the designated primary care provider, our care team will help get them connected to coordinated care and the ProviderOne card updated. Our care coordinator likes to attend the initial appointment when the family and child are meeting us for the first time. So after rooming is completed, the care coordinator would be introduced and answer questions about being part of a center of excellence, make sure the parent has the information booklet from coordinated care. The provider would see the child, conduct the well child visit. We'll ask if we can catch the child up on any vaccinations that might be outdated. And the provider will develop a care plan as well as a follow-up schedule. Prescriptions get sent to the selected pharmacy, referrals are created, and we go ahead and initiate those. So we really try to take a lot of legwork and navigation questions out of the hands of the foster parent and relieve them of that burden as they're getting to know that child, and we want them to put that new relationship in the forefront. So I wanted to share a very quick story about a little girl who came to our clinic recently. We'll call her Sarah. So Sarah is an 8-year-old from the west side of the state who transitioned out of her home to be with a distant family member to care for her here in Spokane. So when we saw her, it was shortly after her arrival in Spokane, and a few really great things happened. The caregiver father who had brought Sarah to the appointment was really overwhelmed by being a new foster parent. It came out of the blue. He had a lot of questions and kind of felt like he was treading water. So our care coordinator gave him her business card and walked him through a few next steps of what to expect, what we were going to help with, utilizing her as a resource. So our provider put Sarah on a weight gain strategy with monthly weight checks here at the clinic. By the end of the visit, Sarah was chit-chatting everybody up. We loved having her come to see us. She chose some great toys and coloring books, and we congratulated her on her successful medical visit. It was fun to be part of that experience, and we appreciated seeing her and know that she's going to do well in this new placement, and are glad to be part of it.
Thank you so much, Sherry. And I put the link to your website in the chat. If you have any, I was looking to see if I had a flyer for Excelsior and I didn't see one handy. If you have anything you'd like to have me share out, I am happy to send over any flyers to Ryan and the CASA team too. So let me know if there's anything or anything special. Would they just call the clinic if they were trying to set up an appointment for a youth?
Yes, just call the main line at Family Medicine, and we've got a spot ready to go. No wait.
Awesome. I love that. No wait. And I see April is on camera. So I will turn it over to April next.
I have a quick question for you, Lindsay.
Yeah, sure.
Do we have time after I, talk a little bit about the clinic to show the video?
Yeah, let's do it.
Awesome.
You can talk, and then maybe I'll turn it over to Ren to share a little bit about Harborview, and then maybe we can jump back and show the video too, because I think it's awesome.
Cool. Sounds like a plan. So we are community healthcare. We're located in Tacoma. We do see patients from anywhere, not necessarily just in Pierce County, but we are providing primary care first and foremost, but also dental and behavioral health care, of course, using that trauma-informed lens as a center of excellence. And so what we're doing is filling in gaps for not just foster children getting the care that they need, but also their family members. So whether it's their biological family, whether it's the foster family, whether it's the siblings of the foster or the children, biological children of the foster family, kinship care, basically anyone who is touched by the foster care system or through adoption. That also includes pregnant teens in foster care, unaccompanied minors, and as I mentioned before, even birth parents who maybe are at risk of their children going into foster care because they've had DCYF intervention. We even had 2 grandparents come in and see us. I think it was today, or maybe it's tomorrow actually, but they're a kinship care family who are going to be bringing in their grandkids, but they wanted to establish care so that the whole family could be seen all in one place. So not only do we want to make it easier, as Sherry was saying, make it easy for caregivers to get access to the care that they need, but have one place, one-stop shop for the whole family to be seen, not just for primary care, but for those dental services and behavioral health services as well. Recognizing that transportation can often be an issue for the patients in our community that we serve. We can also set up bus passes and ways for patients to get here through various transportation assistance measures that we can provide. So our goal is just to kind of bridge those barriers to access to care in whatever way that we can. We're also providing the EPSDT exams or well child checks, but the initial health screenings, we can do those within 3 to 5 days, and we'll send the results to the chat workers and to the caregivers as well. And also wanted to point out that we have the longer appointment times so that we can really build that rapport, recognizing the kids often have medical trauma or just apprehension about being seen in a clinic. So we want to really set up the space and create the time needed to make them feel more comfortable. So that being said, which if we have time, you'll see in the video, the unique sensory sensitive space that we've set up for our family room, which is our exam room basically, is very trauma minimizing and has all kinds of like sensory sensitive toys and comfortable seating areas and couches. There's not a single piece of medical equipment in there. We actually roll it in on a cart and roll it back out just to kind of mitigate any trauma response that kids might have with the medical equipment. We also coordinate the care with caseworkers and with the family. So our nurse will or our MA will go and connect the families to whatever specialty referrals that they need, or follow up with them after the provider has referred them out. Make sure that they get connected with other services in the community, whether that's early learning, developmental, occupational therapy, things like that. Again, just trying to kind of handle paperwork and handle connecting services that foster family or that care family may not have the time or really doesn't know how to navigate. And so tracking down those immunization records and building up that file for them as well is something that we do. We also have a pharmacy and a lab in the same building. So again, kind of all the things under one roof that we can get done for the family. We also, I think I forgot to mention, we also see homeless teens who have either aged out of the foster care system or who maybe kind of were never officially in the foster care system, but that don't live with their family or don't live with a kinship care family. So a lot of times they'll hit us up in the morning for our snack shack, because we have like a little refrigerator with some healthy snacks and some waters and things like that. And so they'll try and make their appointments in the morning so they can come in and grab a bite to eat, because that might be the only thing that they get that day. But of course, then we'll try and connect them with somebody in the community that can provide them a hot meal later on as part of our care. So I think I've pretty much covered everything. Again, just wanting to really connect with other people in the community that are providing social services for children and families in foster care, so that we can find out where are the gaps that we're seeing, work together to see where those gaps are, so that we can work together to fill them and make sure that our patients get all of the care they need. And that's anywhere from handing them brochures and counseling them on what community partners might be a good fit for their needs, and also even giving them a free book from our library. So it might be a book on trauma-informed care for the caregiver, or it might be a book on adoption for the child, or foster care and very specialized type literature that could really help them out. So I think that's pretty much it. I will, if Lindsay hasn't already done it, she might have drop our link into the chat box, but if anybody has any questions, then I'll also drop my email and you guys can feel free to email me or call me.
April. Yeah, I'll turn it over to Ren to share about Harborview next, and I'll put the Harborview link in the chat as well. And then I'd love to just open it up for any questions. And then I'd also really love to share CHC's video too, because it's pretty cool that they were able to get that video put together. So I'll let Ren go first though, and make sure we save some time for questions.
Hi, I'm Ren. I will be presenting on behalf of Harborview Medical Center Foster Care Center of Excellence. This is gathered by Dr. Ilana Feldman, but I'll be presenting today. So I think that Lindsay and Sherry and April have covered a lot of what a COE is. So I'll just kind of skim over a few of these bullet points here. What does make a COE unique is that all the staff is trauma informed with care training. We continue education training, foster care specific topics. We have close communication with DCYF and coordinated care teams. We also have secure email with DCYF caseworkers and continuity of care for children, either by ensuring that they continue to be seen in our clinic or by warm handoffs to other foster care trained providers. And we are working on a local resources list for that. We are part of the pediatrics clinic. There are other parts of other kinship care can be seen in the rest of Harborview, but we're in the pediatrics clinic, primarily seeing foster children. We can provide CHET exams and entry exams and can see children within 72 hours. Primary care for all youth connected with DCYF in foster and adoption. We also have mental health care for primary care patients, a 24-hour nurse line like many others, and ongoing care. We also provide a consult clinic. It does take 3 to 4 hours during this time to assess medical and psychological evaluation for youth with more complex medical behavioral health needs for diagnostic clarification. The team of Harborview Foster Care COE is Dr. Ilana Feldman, Dr. Carrie Gillenwater, and Dr. Candace Small. Our primary care clinic can do CHET and initial screening exams, primary care including wellness and acute visits, immunizations including COVID-19, telemedicine, and mental health for primary care, 24-hour nurse line. It is not for acute child abuse concerns. That goes directly to the ED. The consult clinic is for any foster child in Washington State. As I mentioned, it is a 3 to 4 hour medical exam and evaluation. We'll provide a complete report and a phone conference after the evaluation. I will note that the DCYF caseworker or CASA can fill out the consultation request with a supervisor, and it's not for placement recommendations. Oh, look, I didn't even do my full screen here. There we are. Please feel free to call. The email is a secure email, so we prefer caseworkers and CASA go just directly through the email. But if any parent or caregiver would like to call, we can take them through the steps through the phone call line. Let me see. Yeah, and feel free to email us. The clinic is located on the ground floor. It is in downtown Seattle, but parking is free. We can provide interpreters for phone calls and in-person appointments. And primary care appointments are about 40 minutes long, but again, the consult clinics take about a half of a day. If you have any questions, feel free to ask now, or you can email Dr. Ilana Feldman or just our Harborview clinic. So yeah, that's my presentation for Harborview. If you have any questions, otherwise I'm gonna just turn it over to you.
Yeah, thank you so much, Sherry, April, and Ren. I hope everyone just hears all of the passion and excitement in this project. We are so thrilled to have 3 centers of excellence across the state that really are here to meet the unique needs of kids in care. So I want to open it up for any questions on anything I shared about Medicaid services or Apple Health services in general, coordinated care and care coordination, or to any of the centers of excellence. So feel free, the floor is all of yours. What can we answer for you today? All right, well, everybody think of your questions while April shares a really awesome video. It's a short video, only about 2-3 minutes, I think. So while you're watching, formulate your questions.
Everything we do within foster care, within the communities, it's all about connections. It's all about relationship.
So when my second child came home, I casually mentioned to community health care, boy, this is frustrating. It should be easier for families. It shouldn't have to be this hard. And we needed to develop a clinic that was unique in and of itself. That means that we don't have a traditional exam room that's cold and sterile with paper on a table. So we design a space that does not look clinical. We make sure that we don't look clinical.
These kids have had traumas, and studies have shown that traumas lead to adverse health effects later in life.
So there's a wide variety of care that we can provide for children and families that have been touched by trauma.
Clinics like this support the neighborhood. This is truly Hilltop's clinic. When you go to a doctor's office, there's always that, bright lights. There's always that smell. There's always that crummy little table you sit on that has the paper. It wasn't an exam room we got to go into. We went into that really big open family space.
So when you come into our family room space, you are welcome to have a snack. You are welcome to sit down with your feet up on the table. You are welcome to pick any spot that you want to sit in, and I will work my exam and my history around you so you feel safe. This is such a unique way of providing care that I get excited that I'm ultimately sitting on the floor taking care of a child instead of next to an exam bed, that I may be doing a well child exam sitting on a couch today. I may be doing an entire chalk drawing on the wall while we talk about really yucky things that have happened in a child's life. So by having medical, dental, behavioral health, lab, and pharmacy all in the one location for the entire family who's touched by foster and adoption care, we hope that more people will continue on the path of fostering a child from a hard place or even welcoming a child into their home.
One of the advantages of having a place here at Hilltop is that it's a one-stop shop, and we can literally walk things from one appointment to the next to get filled, to get our dental services done. We can come in here and we can get all of our needs met. It's not a clinic, it's my services.
Just hearing the parents take a sigh of relief knowing that we've got their back. They're not in this alone. I just remember that these kids need something positive no matter what they've been through. I need to be a light for them so they can see that there's other things out there besides the trauma they went through. I just want these kids to feel safe, and by playing with them and building that rapport, makes me feel really good. It gives me a sense of fulfillment, something that doing something like this is my calling.
Yeah, so you can see, all three clinics are different, but all doing really incredible work. And so we just really wanted to take this opportunity to highlight them all and make sure that the word is really starting to get out to caregivers across the state that these resources are available. And, I think long-term, we'd love to see even more centers of excellence come on board, but for right now, we've got the 3 launched. So we're happy to answer any questions. We can feel free to do that. I don't know if maybe it's the recording that's making people not want to come off of mute or put questions in the chat, but feel free to ask anything, and we'd love to answer those questions.
Well, I'll ask if nobody else is going to. What are your plans for expansion into other communities?
Yeah, for the centers of excellence. Yeah, that's a great question, Ryan. I think we are trying to kind of start with these 3 to get a sense of, what it looks like on an ongoing basis and kind of all get, a system in place. But we also have a quarterly foster care learning collaborative, and that includes more practices across the state that are doing really innovative and cool work in the primary care world with children and youth in foster care. And so we're trying to, also come at it from this perspective of how do we get, all the people doing the work in the state together to learn from each other and continue to grow and support, access to quality healthcare services for kids in foster care. So we don't have specific plans yet on expansion between those 3 centers, but we do definitely see the need, and we want to support all the work that's being done in the state. So we also have that foster care learning collaborative for providers. Mm-hmm.
So with those care centers, you mentioned kinship care. Does that have to be a licensed like a dependency kinship care, or could it just be grandma's taking care of somebody else that doesn't have a dependency?
I think that may differ depending on the COE. So I will let the COEs jump in here on whether or not they'll see, kinship placements that are maybe not formal dependencies.
We definitely will at community healthcare. Yeah, basically just anybody who says that they are touched by the foster care system, whether that's formally or informally. Now, the type of paperwork that we would require, might vary based on, if there's not a official foster care placement. But that would just be on a case-by-case basis, anything from McKinney-Vento paperwork from the school to other ways that we can, and depending on the age of the child, things like that. So just on a case-by-case basis, just always feel free to reach out to us and we can answer those questions as we know the situation.
Excelsior is very similar in that we really believe that the entire family should be able to get their health care from the same clinic instead of running across town and being stretched thin. You know, we don't need to create that additional work for people. We are lifespan, so newborn to end of life. We have programs that are great for all ages and stages. Excelsior is also wonderful in that they were originally a behavioral health organization here in Spokane. They've been around for 40 years, really dedicated to behavioral health needs of children and youth. Their purchase of a primary care clinic was very intentional so that they could close those care gaps for that specific population. But we have access to all of that programming within Excelsior, whether it's the holistic school for kids that aren't being successful in traditional school, neighborhood schools, and the programs within the ICC for IOP or BRS. They have a SWIMS program. So there's lots of ways that Excelsior touches the community at large, and we take advantage of tapping into those resources as needed.
And as far as Harborview goes, the Foster Care Center of Excellence is primarily for children and youth. However, Harborview as a medical center will see anyone on Medicaid. So they don't have to be related.
Lindsay, I had a question for you about transportation. You mentioned that that was one of the things that folks could do. I'm wondering could you talk a little bit more about how that works? Where I'm thinking that we might find this particularly beneficial is getting kids in kinship care situations to some of the appointments that, you know, like mental health services and things like that, that they may miss because kinship doesn't have, you know, the resources that a foster parent may necessarily do. So could you speak a little bit about that?
Sure, and I'll put the link in the chat in just a second too. So here in Washington, each county has a regional broker for the non-emergency transportation program. And so the broker in each county is the kind of organization that's responsible for setting up those transportation benefits for people who have Medicaid. And so the family would reach out to the regional broker that's in their community, and they'd need to have, you know, their name and their date of birth and their ProviderOne number or their Medicaid ID number. And then from there, that broker can kind of figure out, well, is this are you in an urban place where there's bus tickets? Or, you know, are you in a more rural location where it needs to be a ride or gas money or something along those lines? Or ferry, right? Depending on where in the state you're located, you may need to take a ferry to an appointment. And so, you know, from there, they kind of work that out. So each regional broker works a little bit differently as far as like what their referral process is like and how you get it set up. So it's really important to just reach out to that broker in the community. And then if you're running into any issues, if a family is hitting barriers and signing up, that's when you reach out to us and you say, the system's not working the way it's supposed to. I need some help. We can't figure out how to navigate this. And then that's where coordinated care can step in and try to help with that. I think most regional brokers ask for about 2 weeks notice for appointments. So it's really not for urgent appointments that come up. It's really for scheduled appointments that a family has.
And is that regional broker through coordinated care or just county infrastructure thing?
Yeah, it's through ProviderOne or fee for service. So it's run through that ProviderOne system. So it's a Medicaid benefit or an Apple Health benefit, but it's not through coordinated care directly, but we can still help families access it. So I'm trying to remember what the exact age cutoff, is, but I know, an older adolescent or youth could potentially, use it for, travel to appointment on their own, right? As they're learning those independent living skills. Okay, well, I'm seeing lots of positives in the chat, so I'm glad this was helpful today. And for those of you who might need it, we'll send out the slide deck as well as some flyers on Teledoc. I want to send you the flyer on Teledoc on healthcare coordination. I can send you the flyer on SafeLink too, and you can feel free to share those far and wide with caregivers that you interact with.
Well, Lindsay, thank you very much for this information. I can't wait to I will edit some of this and add it to our YouTube channel so that others can share. And any of those materials too, I'll also include in the description of the YouTube video when we record it, just so we have it. But thank you so much.
Yeah, thanks for having us and hosting today, Ryan.
Yes, and hopefully we'll see you at the conference. It's in November.
Yes, I would love to come.
Okay, sounds good.
See
Thanks
ya.
so much, guys.